regulate the practice of medicine, and these policies may vary from state to state. The practice of medicine, according to the Federal Code of Regulations 1271.15, allows for an exemption clause so that you are not obligated to follow the CFR 1271 if you are doing something within the same surgical procedure. So the reimplantation of an autologous cell therapy product during the same surgical procedure would be exempt from those good tissue practices. And there's a couple key things that are important there. The cell product must be minimally manipulated, and they must be for homologous use only. There are two types of stem cell uses, either autologous or allogeneic. Autologous refers to the implantation of the cells back into the same individual from which they were recovered, versus allogeneic, where you would be putting them to somebody else. Minimal manipulation include things like density gradient separation, which is what we would be doing with the process to isolate the adipose cells, cell selection, centrifugation, and cryopreservation. Once you're doing anything additional to the cells, including things like culture expansion, this goes beyond minimal manipulation. So illegal practices would include the cell culture and expansion or differentiation, or modifying the expression of the cells, so doing some sort of transduction to make the cells express a protein. These would all be considered illegal practices, and they would require you to go through the process of filing with the FDA to go through clinical trials. An example would be if you were to culture expand bone marrow cells for the use in orthopedic joint injections, the FDA would consider this an illegal practice. So what does this mean practically? There's no legal therapeutic use of allogeneic non-homologous cells outside of the FDA-approved clinical trials, and autologous homologous cells delivered during the same surgical procedure that are not more than minimally manipulated is considered the practice of medicine, and that is the field that we're dealing with. Some prudent cell practices: you want to consult with a healthcare lawyer in your state. You don't want to advertise that cellular medicine cures or treats any specific condition. You want to make certain that your fees are in line with similar procedures. And you want to make certain that your consent promises no specific outcome and states clearly that this is experimental medicine and not considered the norm. So how can you safely, legally, and ethically offer patients ASC treatments? Follow the current ethical guidelines regarding stem cells, education and training on stem cell theory and procedural preceptorships, work with legal counsel to ensure legal compliance with all state and federal guidelines, use things like consents, appropriate materials, appropriate staffing, and get the appropriate accreditation. So what we offer is a stem cell training course. This is a 2-day training for both a physician and an assistant to come and attend at our clinic. We have, in the first day, we go over all of the didactic lecture series. We teach you everything about a variety of different types of stem cells, all the clinical research that has been done to date, and all of the different trials that are currently going on. We also teach you on the second day hands-on. First, we teach you how to isolate the fat sample, followed by how to take that fat sample and get stem cells. In addition, we teach you how to do a technique called platelet-rich plasma, and we typically use these techniques hand in hand. So I always think of platelet-rich plasma like the fertilizer and the stem cells as the seed. So we place the seed into the fertilizer and we plant it. In other words, we take the platelet-rich plasma, put the stem cells in, and those can go back to the body. After you complete the 2-day course, we have a post-educational on-site at your own clinic where we send one of our surgical assistants to do your first cases with you to ensure that you've set your equipment up properly and that you're doing the processes appropriate. We provide all the written protocols required, QC assays, viability, cell count, and we also give you sample-informed consents and all of the different forms that you would need in order to implement this process into your own office. In addition, it's a fully accredited course containing 16 AMA PRA Category 1 credits, so you can obtain those continuing education credits as well. In addition to the 2-day training course, we have a variety of different modules which provide for additional training in specific areas. In particular, we have modules for fat transfer training courses. We have ones for breast, gluteal, and facial fat modules. In this case, you learn the techniques of doing autologous fat transfer using the patient's own stem cells and fat. We go through the anatomy for appropriate augmentation. We review injection techniques. We make sure that you understand anesthetic techniques and prevent and manage complications. These are all done on real patients in the clinic setting, and you have an opportunity to get some hands-on experience. Our process is validated, compliant, affordable isolation method for ADSCs. So one of the main issues to preventing people to moving into the stem cell field has been the high equipment costs associated with it, and also the regulatory limitations. Some of the devices that are currently out there are not currently approved by the FDA, and even if they were, the consoles can cost as much as $100,000, making it not realistic for most offices. So in this case, the equipment associated with the process is right around $5,000, making it reasonable to offer in your clinic setting. We also have consumables that go along with each patient treatment, and these are also very reasonable in cost. We provide competency training for both the harvesting and the isolation, and we have a quality assurance program. So included within that fee structure, we test the samples that you obtain to make sure that you are in fact collecting the right type of cells and that they are appropriate for use going back to humans. All of our kits and processes are made according to current good manufacturing practices, which is an FDA-regulated concept. We use actual clinical grade enzyme, which is approved for human use and could be used to directly inject into humans. And if you go to the next slide, this is a picture of our stem cell kit. So each patient uses one kit to process the fat tissue to obtain the stem cells. Included in the kit are all the plastics and consumables necessary to isolate the stem cells, as well as a vial of the enzyme, which is called adipolase, clinical grade and approved for human use. So once you move into the field of using stem cells in your office, you're going to get a lot of patients that are going to come to you and say, you know, my aunt has diabetes, or I have a friend who has heart failure, and we're wondering about using stem cells for those applications. So when we first started doing these trainings, we had a tremendous amount, and when we started offering these therapies, we had a tremendous amount of patients coming to us and wanting more. And these are things that we couldn't necessarily offer here in the United States. And so what we decided to do was partner with the Regenerative Medicine Institute in Mexico so that we could offer additional applications for patients outside the U.S. So in this case, we're looking at a variety of different applications. So if we go to the next slide. Let's first talk about some of the cosmetic regenerative tissue enhancement, and these are things that you can do here in the U.S. The first thing is looking at autologous fat transfer. If you do a review of the literature to date, there is a great amount of unpredictability with graft retention over the past 2 years. And in the past, after 2 years injection, you can get as low as 50% retention of that graft. And so because of that, there has been a lot of debate as to whether or not fat transfer is appropriate to do and will it just go away. So there have been 2 scientists who have focused out of Japan. Yoshimura and Matsumoto have done quite a bit of research demonstrating that there is a 35% greater graft survival at 6 months when you isolate the stem cells and add those to the fat graft. The transplanted cells were expressed in the vascular endothelial cell markers. So the concept is that you can use cell-assisted lipotransfer or take autologous adipose stem cells and combine those with the fat tissue, where you take half of the volume and make stem cells and then the other half with the fat and put those back in and then use it for grafting. So the combined fat and stromal vascular fraction or stem cells are then injected into the target site. The benefits include that the pre-adipocytes will actually differentiate into adipocytes and contribute to the adipocyte regeneration. So not only are you going to have retention of that graft, but you're going to have potential additional cells that are created there. Those will actually form the vasculature and give the tissue something to hang on to, so it will survive within the space that you put it into. There was a study completed by Yoshimura in which 60 patients were given the cell-augmented breast augmentation, and they showed that there was a 4 to 8 centimeter increase in circumference compared to a 2 to 3 centimeter increase with traditional lipotransfer. The post-operative atrophy was minimal, and the grafts were stable 2 months post-operatively. I'd like to share with you some of our patient results. In this first one, this is actually one of our doctors who completed the training, and while he was down in the training, we did a fat transfer. So the before picture is on the left, and the after picture is 6 months after surgery. So a variety of different things are occurring when you're doing the fat grafting with stem cells. Not only are you going to increase the volume, and you can see this is obvious, the increase in volume there and the reduction of all the lines, you're also going to increase the quality of the skin. The stem cells will actually promote the formation of new blood vessels, but also promote the production of collagen. So the skin is going to get a nice glow, and he's going to have a better tone throughout, a more even tone throughout the skin. If we go to the next picture, this shows another example of one of the patients that we've completed. And then if we go to the next picture, this shows an example of before and after doing the breast augmentation with the cells. So one of the issues and one of the concerns with doing fat grafting without stem cells is that you're going to have a loss of that tissue over time.